My name is Michael. I'm the co-founder of Sedation Inc., and we are the only ones in Florida that do tattoos under general anesthesia. We've been open for about a year now, and we recently opened to the general public about 3 months ago. Yeah, so multiple things happened in my life that kind of triggered me to launch this business. I would say the biggest one was just people asking me, hey, did your tattoos hurt? Different parts of my body. Do you recommend I get it done here, there? I think multiple things kind of persuaded me to enter this niche. One, obviously there was a need for it. A lot of friends and family would ask me if my tattoos hurt. And then also I'm a co-owner of a mental health facility. So I've seen an influx of patients with anxiety, needle phobias, so on and so forth. And my partner and I, we felt that those folks that love the art, but can't necessarily handle the pain or have needle phobia, even though that's a small percentage of the population, it still adds up, and those folks should be able to get the art that they want. And what better way than to get it whilst being sedated? That way you can avoid, and if you have a phobia, you could still kind of get the ink that you want, or pain tolerance is a big one. So it is a good way for all types of people that struggle with all different things to be able to get the art that they want. Yeah. So I would say my leg took about 60 hours. My arm probably around 35 hours tattooing. So kind of looking back, I would definitely say that if I knew of something like this, I would totally have been sedated. I do have a high pain tolerance, but having said that, certain areas were not necessarily fun. The inside of my thigh, the shin, areas like the elbow, the knee, those aren't really fun areas to get tattooed traditionally. So we do general anesthesia for bigger pieces, full back, leg sleeves, things of that nature. If someone is just getting like an arm sleeve or a leg sleeve, we could potentially do a nerve block. So the patient is not necessarily completely out. It's just blocking the nerves so that they don't feel the pain. Those are the two that we use. I would say overall it's low risk, just your general things such as sore throat, nausea, dizziness, things of that nature. Yeah, I think the biggest things that we always tell people is to be well rested, to make sure that they're hydrated. And then obviously for women, we want to make sure that they test for pregnancy. So take a pregnancy test 72 hours prior to the operation, just to make sure that they're not carrying. Obviously, they can't go under if they're pregnant. So we also do another test the day of the op. So we have two different options. We have the 4-hour block or the 8-hour block where the client's under sedation for 8 hours. For the 8-hour, the full day, the client will be at the surgery center between 10 to 12 hours, a few hours pre-op, and then a few hours post-op. For those clients, we're doing more of larger pieces, such as full back, leg sleeves, arm sleeve with a full leg. For the 4-hour blocks, we're doing more of like a half sleeve and then a piece on the neck. Those can be done in 4 hours. It's less breaks. They can focus on a canvas that doesn't, you know what I mean? Obviously the client is sedated, so they're not feeling anything. The numbing cream isn't wearing off. There's been, I don't want to dog numbing cream, but there's been, whatever you want to call it, statistics or information, or that numbing cream actually prevents the tattoo from healing properly. I don't want to talk about it. I don't know. The risk of infection is usually higher with numbing cream because when you're drilling, there's a chance that it's going in the skin. Doing it at the surgical center is usually the most sterile environment that you can do any procedure. So in terms of like getting any type of infection, obviously the state, it has higher standards for operating rooms than for tattoo parlors in terms of cleanliness and being up to code, things like that. But I guess, I think the biggest thing is just the time, right? So with numbing cream, you can't really have multiple artists blasting you for 8 hours. Listen, I'm a big fan for numbing cream for smaller pieces. I think numbing cream is a great way to avoid the pain maybe for a few hours. I know a lot of tattoo artists like it and help the person getting tattooed manage the pain throughout the process on a smaller piece. In my opinion, on bigger pieces, it doesn't really work. Under sedation, the tattoo artist can really get to work and not have to worry about any breaks, not have to stop because of the client being in pain. The artists tend to prefer a little bit more to be able to work without having to worry about the patient and moving around and things like that.